So we'll call this OHM BOCES Cooperative Board meeting to order. We'll start with the Pledge of Allegiance. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Well, welcome everybody through the Zoom world. And we're going to start off tonight with recognition. We have none. We have no recognition, no visitors, right?
Right.
And it's a closed meeting. We do have to announce that the meeting's being broadcasted, do we not?
Yep, it's being broadcast. Yep.
Being broadcast live, so live from New Hartford. And then we go on to communications. We'll start off with Elaine, and she's going to just see if she has any comments about the audit committee report and recommendations. Elaine?
Okay. In your packet on page 51, there begins quite an extensive review of the audit committee's meeting that we had about a week ago. Actually, it focused primarily on the controller's report relative to the information technology program. The state had picked up several things that they felt that we should address, mostly with process and procedure. A lot of the items are very difficult to address, but Scott did a great job in sending information to them, telling them how we were going to work on this. So I think we're just going to be fine with it. The committee spent a lot of time listening to it, and we understand where we're coming from and where we're headed. And in about 6 months, we're going to get another report. The committee, every time it meets, will get a report on how their plan is going. We also had to reapprove the submission of the original audit recommendations because apparently they were sent in without a date. And we had to add the date to them, so they are on your agenda today also to take care of. And we talked about going out for an RFP for auditors. Generally, our process has been that we go out every 5 years. We are at the 5-year period, so we're going to begin to work on an RFP to recognize, review, identify auditors for our general audit. And that was basically the meeting. It was a short meeting, but we covered a lot of things, and Scott did a great job in his presentation to us.
Nice. Good. Are there any questions from anybody? Thank you, Elaine. Any questions from anybody about the information shared? I have a quick question for Scott. I know he's still on the phone.
Go ahead, Mr. Boucher.
You implemented the training software. It says no before. Is that something that you got from some software program that teaches everybody what to do and how to handle the computer safely, or sign on, sign off, passwords, what have you?
Yeah, so the Regional Information Center purchased it on the behalf of 52 school districts a year and a half ago for the purpose of training staff on, email, phishing, vishing, the things that people need to look for to keep their environment safe. Gotcha. So we implemented that last year. We've also got a training program that's now been adopted in orientation, right? And then know before will be used 2 or 3 times a year. It's nice because it's got a wealth of trainings built into it.
Nice.
And once you get the user base loaded, you can initiate trainings really on demand. So it's certainly something the state wants done every year, and I think we're positioned nicely to do it.
Yeah, I'm sure you have a lot of employees that just don't realize that they're making certain types of mistakes. They, because they operate on their computers at home, they're not realizing that this is a work computer and they can't probably do the same type of operations.
Yeah.
Yeah, it was interesting because when we initially rolled this out, there you go, John, I see it right now. So when we initially rolled this out, I was expecting the percentage of employees that would click on a malicious link would have been probably 40 to 50%. And initially when we rolled it out, it was less than 10.
Wow.
So
good.
it was quite impressive, honestly, that staff had become aware of this without training, but obviously the training is needed.
Yeah, absolutely. In the 30-day deactivation time frame, was that always in place, or is that something you implemented?
No, that is a result of this audit.
Yeah,
That's
good.
The challenge we have with it is we have so many employees that are on our payroll that may not work directly in the organization, right? So, Ann Turner's got quite a few of them that are on the payroll. They need accounts in order to get access to email, but aren't here. So we really didn't monitor that well, right? So now what we're going to do is looking at that every 30 days to see who has not accessed that account, and we will disable it. We're not going to delete any of them, obviously, but they'll be disabled. And then if that user needs access, his or her supervisor can communicate that, and that'll be turned on.
Nice. Awesome. Well, thank you. Any other questions from anybody about the audit? Nope. Okay, hearing none. Thank you very much. How about communications from the floor? Doctor, do we have some other communications from the floor?
Not at this time.
Nothing at this time. And so I'll turn over the correspondence portion to you. The C is correspondence for Capital Conference in NISBA.
Yes, so there are conferences, of course, that we normally go to physically that are now being provided virtually. And Deb Kimball, correct me if I'm wrong here, but the Capital Conference is free, I believe, because we are already school board members, New York State School Board Association. So if you're interested in attending the Capital Conference or any of them, as a matter of fact, please reach out to Deb Kimball. Deb, do you know the price point just you have available for the National School Board Association Conference?
I thought it was around $6 something a person.
Yeah, so we were surprised that though virtual, it's not much less expensive than if you attend physically. But if you are interested in attending that conference or you want to find out more about that, please reach out to Deb Kimball so she can make arrangements on your behalf.
Well, super. Thank you very, very much. And next we go on to the district superintendent's report. You're back on.
I am back on. So first and foremost, there's Chris Hill. We've talked about the annual meeting. So Chris Hill puts together the meeting of the annual meeting. So staff can start to get together to plan what that might look like. And of course, we're not very optimistic that we can try to have a fully in-person annual meeting. I have yet to experience a BOCES in-person annual meeting at OHM, and I'm really looking forward to it. But it does involve over 100 people coming on site, breaking bread together, not really COVID friendly. So there's some other options that the group is exploring, and I'm going to ask Chris Hill to touch upon that briefly with the board.
Yeah, so we've been at what's called the annual meeting. That's what we call it. We discussed, different options for the annual meeting because, as Dr. Kilbert had mentioned, a traditional annual meeting on the traditional date is probably not realistic. So we looked at a couple options. Handling the business portion of the meeting virtually is probably something we'll look to do, and then we'll look for some different kind of replicant activities or substitute activities throughout the year. The rest of the year, whether it's creating virtual tours that we can send out to boards and things of that nature. We looked at the possibility of doing something on campus maybe late in the year, like near June, do some of the tours and the dinner. The challenge there, to be honest with you, is the students have not been on campus a lot. So their ability right now to create a meal is probably not what it would normally would be at this time, or the ability of students to give demonstrations is going to be limited because of the amount of time and lack of familiarity on campus. But that's a hurdle that we're going to look at. So there are a couple different options. We're looking to try to replicate some of that experience because, again, we'd really like our new district superintendent to experience that fantastic meeting as it normally is.
One of the things that was mentioned in some of the discussion and then afterwards is that that pocket of time in the late year is such a busy time for schools in general, and that if we're able to start getting things to kind of happen again, graduations, proms, end of the year celebrations are probably going to take some priority there for local districts, but there might be some chances there. Gary.
It's probable that you're not going to be able to do an open house here either. So I was kind of wondering if you could combine doing a virtual tour of the place with the open house, that you do a virtual open house and and maybe marry those two things together. Just a thought.
A proposal on the table for a unique kind of marriage, Chris Hill. Sounds interesting.
Yeah, absolutely.
I like it. Thank you, Gary.
That's a cool idea.
That is a cool idea. Any other questions? Okay, moving on. COVID testing. So we were able to test employees recently over the past 3 days. You know what? I just realized I don't see Tom Dorr. Oh, there you are, Tom Dorr, right there in the right-hand corner. We were able to do some COVID testing of our employees. We did a small pilot just to get kind of our feet wet with what COVID testing would be like on December 28th. And then during the past week, we were able to bring some employees in to test. It was successful. People were able to come in and come out and test. We also attached a survey so that as they tested, they could respond to a survey to give us information on how we can even do better. And I'm just curious, Tom, do you have any figures for us on how many might have tested or where we were with that?
I do. On December 28th, we tested 54 people. We did have 3 positives out of that, which is interesting because, again, you're supposed to be able to pass our screening test before you come in. But it's not all that much alarming because, again, as we're finding through this, you can test positive. They're saying up to 90 days after you were infected. I mean, you could be feeling absolutely fine. You could have been asymptomatic when you originally had it. So you may never have known that you had COVID. But so the first round on December 28th, we tested 54 people, 3 positive. And then last week we had instructional staff in. On Tuesday, Wednesday, and Thursday, we tested 112 people, and we had 2 positives. Put those 2 numbers together, and we had about a 3% positivity rate, which would certainly be beneficial to the overall county figures at this point. So we're looking forward to doing more testing and hopefully to get the numbers down all over. And I can say that's probably true for all of our component districts. We're shipping out test kits every day. Remsen called for a few more today. I think Oriskany also, and Weisboro was very active with it. So they're all geared up and trained and ready to go. So if we get into a zone, I think we have the ability to at least test. Whether we can test out or not will remain to be seen, but we're up and running.
So, you know, there's some positive feedback with that. Some of the challenges have been for us as a BOCES is that, you know, we continue to support our component districts who right now in large majority are fully remote and not yet open. So when we're going to be able to bring kids back onto our campus and start testing them back in might shift accordingly because we're working in collaboration with the peer districts who are sending us children or in some cases not sending us children. But we are prepared to do that. We were pleased to see the testing program come out and in large part be successful. And we got our feet wet. So when we're able to open our doors and have children and staff return and start having to test for that 20%, I think we're going to be prepared to do so. So that's some good news. The next piece is vaccinations. I don't have any official news on vaccinations. As you know, the governor said that employees in schools now can become vaccinated. It began like this rush on the site. So I can tell you from my own experience, I've had a bear of a time trying to get scheduled for vaccination because they're just full everywhere. And some people have joked, a group of peer superintendents that I was speaking to, that it started this migration a little bit, like I'm going to Syracuse on March 3rd for mine, you know, so everybody's kind of like moving around the state trying to find places to get vaccinated. Certainly, we hope that more vaccine will come to New York and open up more opportunities. And we are meeting with the county executive and the new director of health for Oneida County tomorrow morning at 8. We're meeting with the local superintendents. Hopefully, he can provide us some updated information about vaccine. He has made some public statements, I think 3 of them at this point, stating his belief that schools should be closed and not open for in-person instruction until maybe February or until there can be more vaccine brought in. And that creates a unique circumstance for school districts. For example, we have some school districts in our region that are open right now. They're conducting their testing and their infection rates are really low. So for example, though the regional rate is at, you know, upper 9s, I think at this point, our infection rate on just faculty was considerably lower than that at 3%. So there's that balance piece that local superintendents are trying to juggle. You know, there's an expectation being voiced that schools stay closed. They have testing kits. They're interested in having some kids come in and test. There is the concern about community spread and hospital capacity right now. That's a significant concern, and we're very much aware that the hospitals are really kind of filled to the brim. And there's vaccine. Isn't it so great to say we have it? But boy, do we wish we could have it sooner and more of it. So you'll hear a lot, I think, through the next few weeks about schools and the rationale they have to use in the decision making to keep schools open or not, and the next steps. So hopefully, as I get more information about vaccine, I can share that with the board through the update and maybe even through another meeting. So look for more there. And that closes my portion of the report.
Dr. Kilburn,
Yes.
I happened to be at a county meeting earlier today, so I know a little bit more about the vaccinations, what's happening.
Oh, great.
And some of the confusion. So what I learned today, and you'll learn tomorrow morning at 8, that there's no guidance coming from the federal government, as we know. And then there's really no guidance coming from the state government to the county government either. The governor wanted to give a vaccine as quickly as he could to the hospitals, but the hospitals are overwhelmed with what's going on, just taking care of people.
Right.
And they've been focusing on vaccinating the healthcare or the healthcare community. So the counties have decided to open up these, what Mr. Percenti will call pods, and the good people up at MVCC have already started one.
Yeah.
And what I'm hear from people that are county legislators that have had relatives go, it's going along very, very smoothly, and they're able to give vaccinations to hundreds of people a day, compared to, like if you went to the hospital, if you could even get an appointment, you get to get. So it's very, very difficult. So help is on the way, but it's supply and demand too. The supply of the COVID vaccination aren't as plentiful as they once thought they were going to be. They're getting like 3,000, and they got like yesterday the county got another 1,800. I mean, they're not getting 10s and 20 and 30. They also have to store them in a certain type of freezer, and so
Yeah.
it's kind of complex. But the county is jumped on the forefront of going ahead and trying to. You're gonna see something with a drive-through clinic coming up at Griffiths that'll open up like in days. So they just had to work out the details. But MVCC, that's going wonderfully, and so they hope to start being able to vaccinate that next wave of people, the B1 and what have you.
Oh, I'm looking forward to it. All I can tell you is that if I can find one sooner than March 3rd, I will be in line happily waiting to get my shot.
The other thing about jumping across the borders, people have gone to Madison County and Onondaga County, but by doing that, they've depleted the supply. So you might call Madison or Onondaga today and find they have nothing.
Right.
So Oneida County's been trying to, they made an arrangement through Mohawk Valley Health Systems, Elaine can tell you, to be one of the regional Mohawk Valley. So they've been using different, stricter rules than other counties. So that's why you see some of that jumping over the border.
Some of the migration, shall we say.
Yes, absolutely.
Wonderful. Well, thank you for that update. I appreciate that.
Yeah, it helps on the way, but they're really looking for more vaccines. It's funny about government is that that when you're at a town government, you blame things on the county, and the county blames them on the state, and the state blames them on the Fed. So they keep rolling uphill. But
That works.
the governor has a really weird way of rolling all of this out. I mean, it's been odd. So anyhow, but that's where it's at. But help's coming.
Good.
All right. So I'm sorry. So you were ending up. Anyone have
I
a
was
question?
done. Yeah, I was good.
Okay. All right. So we'll move on to section number 7, which is the approval for the minutes of our regular meeting for December 9th, 2020. If we can get a motion to approve those minutes.
So move.
Moved by Mr. Salerno and second by
Second,
Mrs. Belville. I see. I could. Okay, good. Very good. Discussion and all in favor, say aye.
Aye.
Okay, motion carries. Approval of the minutes. Now we're going to go on to get a motion for the approval of the consent agenda B, C, and D with the withdrawal. We're having a withdrawal of C2, C3. Okay. And Dr. Kilburn, did you want to talk to C2, C3, or did you before we move on?
Yes, item C2, C3 is an employee that was hired And we said, hey, great, love to have you, but did reach out to us recently and said, appreciate it, but I'm not able to move forward with accepting the position and beginning. So we are back to the drawing board on that position.
Okay, very good. Okay, so with that withdrawal, we need a motion to approve consent agenda B, C, D. Can I get that motion?
So move.
Moved by Ms.
Second. Yep.
And second by Charlene, I think that was. So,
Yes.
oh, perfect, perfect. Okay, discussion? Hearing none, all in favor say aye.
Aye.
Any motion carries. Okay, that takes us over to board topics. Number 8, board topics, where Dr. Kilburn, you're back on.
Well, this is kind of a blended conversation. We have our next retreat. We had pushed it into January because of COVID. And here we are looking at January 23, and what do we still have? COVID. And you've all had an opportunity to go through the thought exchange material that was sent to you. And so in the development meeting, the officers were really wondering, how can we start to engage in discussion? As board members, how can you start to engage in some discussion around that thought exchange while you're in a Zoom world? And it's probably not the best format for that kind of discussion. So how might it look in person? Is there a way we can convene in person to have that discussion? And if so, is it January 23 or is it later than January 23? So really, this is kind of the board's discussion, but I think we kind of need some feedback from the board.
Tough.
I can say one thing. On the 23rd for the retreat, there are a couple board members that would prefer to come to campus if we could do it and you could provide us with an opportunity to do it safely. I would prefer to be there if I could, although I'm not as concerned about some of the safety, but I am concerned with safety. I don't want to say that, it's a public meeting. I'm concerned, but I would like to be there. And a couple other board members have voiced concern to me that, you know, they could just hear better or see better, interact better if they were on the live portion of it. If other people want to stream in, that's great. But they would feel comfortable coming to campus if you could provide us with an opportunity to be away from each other a little bit, but maybe in the same room.
Now, is this January 23rd?
Yes, that would be 10 days from now.
Okay. To tell you the truth, to go through these things, I read through them. And I was interested in having some discussion. I read some of the superintendent's comments and I had thoughts about, is it different than it normally is and this kind of thing. But to do it on Zoom is difficult to do. I mean, as board members, we need to evaluate what they said. We need to evaluate what we said and connect them and then reach out and do what we need to do. So I think it's better to have a discussion face to face. I make a lot of faces so people could tell what I think. See, and there maybe they can't.
Not a poker player.
Not a poker player.
I'm very insightful as far as I'm concerned. I know what's plus and what's minus.
So the other part of the conversation was, in what ways could we make in-person safe? And is January 23 a comfortable date to continue that, exploring the idea of coming together in person for a retreat?
Now, as far as I'm concerned, I'm having my vaccination the 30th of January. So a few days after that, I'm going to be in Florida. So I would be Zoom at that point. So the 23rd does work for me.
Okay.
How about others? Does the 23rd still work fine? Everything good? Because, and it looks like we could probably do something. Dr. Kilburn, you arranged for us with the tables and a distance before. Perhaps we could do it again.
Well, I think so. Some parameters that one would have to consider are, I will have to do some follow-up to see what is the in-person status of schooling. Because one of the things I'm wondering is, would we require, I don't think we would be required to test for the 20%. So I think we're fine with that. Yeah, I think depending on the number. So if it's not the whole group, right? So if it's less than the whole group that's coming in person, I think we probably want to exceed the 6 feet. The CDC recommendations have now been to 10 feet of social distancing with masks because of the air the fact that this is airborne and the fact that we're indoors in winter. So I think we'd have to look at opening up Oneida room with the room, Madison and Herkimer, creating a bigger space, and maybe trying to find even more space between the tables and still be able to hear each other. So that will be something we have to figure out logistically. I would like to offer that if you do want to explore coming on campus, that we test. It's such a simple thing to do, but we can actually COVID test your way in the door. You can have a COVID test and wait the 15 minutes and know whether or not you have it before you come in. I think that would put people at a level of comfort. But we would ask that you still be mastering that time. And we might have to rethink food because taking the masks off and eating is proving to be very problematic. That's starting to spread.
You don't have to eat.
Right. Right. I wonder if we want to do something shorter or smaller, something that maybe starts at 9 a.m., like 9 to 11 a.m., and just have a discussion. So you can come together for a discussion about the thought exchange, and then we'll kind of leave it there. And then maybe if we have to come back together again in a month for another small time or 6 weeks later for another discussion, that might be the smartest way to do it, to cut down time that we're together physically in a room.
I'm having audio problems hearing you, Patricia. This is the 23rd of January?
It is, Mike, the 23rd of January, yes.
That's a Saturday?
Yes, it is.
And the event is?
It would be a board retreat.
Oh, weekends in January are very crowded for me. We have family things almost every weekend.
Right. So we had set aside this date a while ago, so that's why we're bringing it up now, because it might be
I know. I registered
right?
that too.
Yeah. So I think what we could do is something hybrid. So I do think if all 12 board members want to come together in person, I think that's possibly an insurmountable challenge to have that many people in a room for that long. But I'm getting a sense that some people would prefer to come in virtually while others would prefer to come in person.
I personally makes more sense with this important thing that we're doing. As you say, we may only need a couple of hours on this and then do other retreat items along the way.
Yeah.
But we could do it hybrid. I mean, some people who want to do it by Zoom would do it by Zoom, and those of us who would like to kind of discuss and debate and that kind of thing could get together.
I think, Dr. Kilburn, we'd have to spend some time, and I'm not thinking Robert's rules, but I'm thinking we'd have to spend some time to figure out how we can respectfully give people virtually their proper amount of time to really talk and give feedback. Because I think sometimes in this environment, it becomes difficult. And we almost have to force the issue. We have to stop the bus and say, okay, we're going to give the next 2 minutes to, John over here to talk. And because otherwise, I think you'll lose it again. I mean, we'll lose those people.
Well, that makes sense, to give each one who's on a virtual situation a time to comment.
Right. Because even in the live scenarios, for those of us that talk a lot, like myself, sometimes people that don't speak up as much kind of get pushed aside by accident. And in this environment, it's even worse.
Yeah. Sorry.
Yes, and I think what we could do is have someone moderate the chat and moderate the Zoom. So we'll be physically located. One of the people who's physically located will be on a computer and say, "Oh, Mr. Moore has a question or would like to make a point," and then we can build that in. So I think that's possible. What I will need to know is who would prefer to participate virtually, so that I can understand just how many people. So two things: who's going to participate virtually, who's unable to participate at all, and then who's planning on attending in person. So Deb, I'd ask if you could put something together and reach out to the board members via email so they can respond to you and you can tabulate that for us, so we can make some decisions there. And as we know with COVID, if suddenly things change, be prepared for change. We're getting really good at that now. Oh, that's changed? Okay. But right now I feel that we have a good plan. And I think just having an opportunity to discuss and come away with maybe some key common understandings would be a great goal. And we'll just keep it small and simple, just like that. And then we can return at a later date to explore maybe some of our findings from that discussion and what our next steps will be.
Trish?
Yes, Charlene.
Trish?
Yes.
Could I, did I understand you say that if we did decide to come in person, that we would be able to be tested
Yeah, so I think what I'd like to do is see if we can't offer COVID testing so that you could drive up in your car, let us know that you're there. We could let you COVID test, and then you could just hang out in your car for the 15 minutes, and we'll let you know if you're negative or positive. And if you're positive, you drive away and no one knows. It's very discreet. And if you're negative, you can come on in. But we do stress that if you are negative, I would still ask that you be masked, because though negative, it doesn't mean that you not necessarily don't have it. It just means you don't have enough antibodies or antigen. You don't have enough virus level to trigger a positive on the test.
Okay.
Okay, so
All right.
we'll
Thank
talk
you.
about all those arrangements. You're welcome. Deb, I think we'll set up a meeting and maybe with Ann and Senior Counsel Tom Dorr to coordinate what this could look like and how we might set that up to include some testing, to include virtual participation and in-person participation, and to structure the conversation so we can get everybody involved and also be cognizant of our time.
Okay.
Okay, sounds like a plan.
Awesome. So, Doctor, does that cover thought exchange too for you?
It does. It covers the whole shebang. We should be good.
The whole shebang. All right, perfect. I'm moving on to old business, and I see none. So there's no old business, so we don't have to address that, which takes us next to executive session. And I remember we don't need a motion to go into executive session, if I recall correctly, right? We just need to
We
We
need a
need
motion to go
It's
into.
coming out.
go in, but not to come out.
Right.
Gotcha. So may I please have a motion to go into executive session for the purpose of discussing the employment history of a particular person?
I'll move.
So move.
Moved by Mr. Moore and second by Mrs. Corbin. And okay, we're in executive. Who do you need, Doctor?
Well, we're not there yet. Yep, I need everyone. So I
Need
need
everyone.
you all. So Scott, can you bring us all into a room, including yourself?
I can.
Oh, and Deb,
So we're all back. Thank you very much for everyone's participation. Great information. What we'd like to do is set up, with your guidance, Dr. Kilburn, a special board meeting before the next meeting, obviously, that we can all come together to make some announcements and to move forward.
I'm wondering if there might be some availability among the board on Wednesday, the 20th, for a 4:30 virtual board meeting. That should take maybe an hour.
Wednesday the 20th. Okay. I can make that work.
Is there anyone here who cannot? Can you speak up if you cannot make that work?
A week from today.
A week from today.
4:30?
4:30. It sounds like that might be a doable time and date. So Deb, if you could put that together and send out an email to everyone with the information for that and set it up, post the meeting just like you would a normal board meeting.
I'm sorry, Dr. Kilburn, I'm having a hard time hearing you.
Sorry about that. So we're going to move forward with a special meeting of the board on Wednesday, the 20th at 4:30. So if you can make arrangements to post that and get to post it and put the ad in. Yep.
Okay.
This is Yvonne. I'm sorry, I had to look at two calendars. I won't be able to make it on the 20th, okay?
Okay, so do we want to look at a different date? Would that be better? We can look at Tuesday, the 19th.
Well, your Yvonne has listened to this presentation if it's just one person.
Okay.
I don't know. How do you feel about it, Yvonne?
I'm fine, as long as someone updates me, I'm okay.
It's
right.
just kind of a repeat of this.
Yeah, I'm good.
Okay, so Yvonne is going to move.
Dr. Kilburn?
Yes,
Dr. Kilburn, Gary Porcelli. January 20th is a relatively important day nationally.
Yes, that is true. It's Inauguration Day. That might have some significance in particular. Maybe we could.
And the 19th may be as well, depending on what happens congressionally. I'm not invoking anything political here. I'm just pointing out that there will be some concerns for some people.
Okay. Do we want to continue moving forward with the meeting at 4:30 on Inauguration Day, or are we thinking we need
Yeah.
to schedule?
Yeah,
Gary?
let's
As
move.
long as we can all make it, unless anybody on this call is going to inauguration, or, I think we're okay.
Yeah, right,
I
we're on.
can cancel my plans.
Okay, so,
I may not be able to make it depending on what happens.
of course, I understand. So let's see what happens. And let's hope that we have a nice, smooth, peaceful transition in our country, correct? We could use some of that
Would
now.
would the superintendent consider the possibility of moving to the 21st?
The 21st is a board policy committee meeting, so it would require moving policy.
Well, what's the problem, Gary? Do you support what she's going to bring up, or?
I don't have any problems with our agenda. I'm just thinking that given the mood and tone of things that are happening on a national level, I may want to be looking at my television set and see how things are unfolding.
Okay,
So,
well,
if the board,
if you were just another person not being there as Yvonne is, then we could still have it. It's a repeat of this thing. Maybe Debbie can take attendance and call and make sure that we're going to have a quorum there.
I have no problem with the board going ahead. If I'm there, fine. If I'm not, I would go along with consensus anyways.
Okay.
So let's move forward then and stick with that date, Doctor.
Okay, so January 20 at 4:30, and we will be hopefully meeting in a peaceful environment, 4:30 p.m. virtual. We think about 1 hour for a regular business meeting. Okay, I think that meets our needs. Mr. Boucher, we're good there.
Okay, very, very good. So I guess the next item would be a motion for adjournment. Is that correct? I would like to if someone would make a motion for adjournment. I see Mrs. Corbin and second by
Tony.
Tony Nicotera. Perfect. All right. Barring nothing else, meeting adjourned. Have a great night, everybody.
Thank
Thank you.
Okay.